Welcome to the Natural Allergy Treatment Podcast. I'm your host, Jess, and at Health and Wellness Australia and Auckland, we have a team of naturopaths around Australia and New Zealand who specialise in a natural allergy treatment called Positive Association Technique, or PAT. And joining me today is our Brisbane naturopath and PAT practitioner, Belinda Byrnes. Hi, Belinda.
Hi, Jess.
So, Belinda, you've been working with us for a few years now, performing PAT in Brisbane. And in your private practice, you also specialise in working with skin conditions, especially childhood eczema. So today I'm excited to talk more about your approach to helping parents support their children with eczema and how you use PAT as part of a combined approach. And you actually developed this particular interest in skin conditions due to your own experience with the skin issue, didn't you?
Yes. So I guess a 10-year kind of journey cut down into a couple of minutes. I was never diagnosed with eczema exactly, but what started with, for me, it started when I was about 20 years old, and it started with small little sort of pustules on my chest, which for a couple of years were not a big deal and I didn't really do anything about. But they started to get worse. Then I started on the GP cycle with the creams, the antibiotics, referrals to dermatologists, X-ray therapy I think I had at some stage, which I'm sure that was great for me. But anyway, that's another story. And yeah, that just got worse and worse over years. It eventually turned into more eczema-like symptoms on my abdomen, which I got very, very itchy, broken skin, and so on. By those last couple of years, I was starting to trial foods, removing foods from my diet myself. And when I would say to my specialists, I think foods are making a difference because it seems to come and go depending on what I'm eating. And they would say, food has nothing to do with it. So that's not right. Mm-hmm. And, fast forward a little bit longer and I ended up seeing a naturopath myself. And within the month, it was all gone and never came back.
Yeah.
So then that was kind of like, what is this sorcery? How did that work so easily after so long? Anyway, so then a couple of years later, I was studying nutritional medicine, then naturopathy, and here we are.
Yeah, perfect. So what are some of the most common struggles that you see with the clients that you work with now?
Yeah, so, I mean, that is so with skin conditions, obviously, yeah, that's what they're coming to see me about. But the thing that I hear people say most is that food cycle where they're trying to find out what is causing the problem. Mm-hmm. And that is it can be a very stressful cycle for people because they're taking foods out, they're testing, was that it? Maybe it made a bit of a difference, maybe it didn't. And it's all very confusing and stressful and frustrating. And it often doesn't actually work that well anyway. So they're going through this process without actually getting the result that they want anyway. Mm-hmm. So that kind of food elimination cycle is the thing that I think people find one of the more stressful things about having a skin condition.
Yeah, and it creates so much anxiety, which I imagine would play into the symptoms as well. So how do you approach eczema management from your naturopathic perspective?
Yeah, so from a naturopathic perspective, we're obviously looking at things a bit differently because the conventional approach, which people have often already done. So when they get to me, they have already done, like I was saying about in my situation, they've already been to the GP, they've already been to the dermatologist, and they're on stronger and stronger creams, which they're not overly comfortable with, especially with children, because there is, problems that can't arise from that as well. So yeah, unless there is a very specific food or food group that I can see is we have this food, it causes a flare, then I don't generally recommend trialing all these eliminating foods and food groups anyway because of the problems that can come from that. But we can get to that. But the problem is the sensitivity itself. Mm. So why is there that overreactivity and sensitivity? And that's what we want to deal with to get that really good long-term result where the body is much more resilient, much more able to deal with all these different foods without flaring.
Yeah.
And that's when we want to look at things like the digestive function, immune system function, skin barrier health. Is there an issue with the skin barrier itself? I mean, things like genetics even play a factor, obviously, but genetics doesn't also determine symptoms either. So, but we need to consider that in how we're managing each individual case.
Yeah. And you mentioned before the impacts of potential food elimination. What are some of those potential impacts that you've seen?
Yeah, I mean, there's a lot and it will vary, right, between people. But firstly, you start to eliminate, and I'm not even talking about not taking out some gluten or something like that. The more complicated it gets, the more this becomes a problem. But you're then looking at nutrient deficiencies or insufficiency at least. Because when we're looking at eczema, you need to be considering in the first place, what are those nutrient levels specifically, a lot of different things, but zinc, essential fatty acids, vitamin D, and so on. They're very important for that function when we're looking at eczema anyway. But then you start to eliminate big food groups and a lot of different foods, and that can become potentially even more of an issue because you're also eliminating all the nutrients that go along with those foods as well, So the risk then becomes greater that there are lower levels of those nutrients. And when we're looking at that, what is causing those lower levels of nutrients in the first place, apart from food elimination? Maternal diet. Like, does the mother have this kind of problem as well? She's been eliminating foods during pregnancy. Was there an issue there? A whole bunch of like digestive issues that will then lead to poorer absorption of those nutrients. So there's all those factors that you want to be looking at as well, right? Because you need those nutrients to be building healthy immune cells, healthy digestive cells, healthy skin. If you don't have all of those nutrients, you're going to have a much harder time doing those things,
Yeah, for sure. And like you mentioned, say cutting out gluten is one thing, but then when you're cutting out bigger food groups, are you talking about like salicylates and amines? Or
yes. So so that what I will find that people have started to do is gluten and dairy are your first couple that people might try, right? But then you start to look at salicylates, amines, histamine, all of those type things. They're big food groups. A lot of foods in those groups and a lot of healthy foods in those groups. You don't want to be avoiding them unless you really, really have to, and that's a very temporary situation. If you are avoiding those things, that should be a very temporary thing.
Yes.
While we address why that's even happening, So I mean, the other types of problems that we look at, I was getting off track. The other types of things that we're looking at with food elimination is the emotional impacts of that. So the emotional impacts on the family, the entire family around meal times, creating a lot of food fear and anxiety for the parents, for the children, and the entire family, really. It's a lot of extra mental load on especially when we're looking at like children. It's already hard enough to get them to eat certain things anyway, and then you're having to throw all this into the mix as well.
Yeah, and school and daycare and all those external factors as well.
All of that stuff. And then I'll have a lot of breastfeeding mums. So they're having to remove these foods as well. If they're trying to work out what's causing the problem, they're having to do it as well.
Yeah.
Which then you have potential and nutrient issues for the mother, but you also have potential issues with milk supply when you start to remove a lot of food. So it becomes
it's a rabbit
very
hole.
stressful.
Yes. And could you also explain when it comes to those food intolerances like salicylates and amines, it's usually dose dependent, isn't it? So that can make it really hard to pinpoint if you are reacting to them or not.
Yes. And this is where the biggest problem exists, in my opinion, is that it's nearly impossible to work out on your own because one, actually working out which of these foods are high, low, medium, in all of these different things, but also it's not just you have salicylates, you react in an hour later. How many salicylates have you eaten in that last, whether 24-hour period, however long, So, one time you'll have a high salicylate meal and everything's fine. But if you've done that for the last couple of days, that salicylate load is going to be higher. So you may react, but is it the food? Is it the salicylates? Is it, you have berries, avocado, something one day and you're like, oh my gosh, that's causing the problem. You have it the next day and everything's fine.
Yeah.
So it's very, very difficult to work out.
And it's all about that tolerance threshold, I guess. That's what's going to be different for every person. And
exactly. It's different for everyone.
Yeah, and trying to figure out it's may not like salicylates is probably one of the biggest ones that we see in clinic, but it can be amines and histamine as well. And once you combine all three of those going into that bucket analogy, just slowly getting topped up with every meal that you have, and suddenly you have that big flare up, it just makes it impossible to pinpoint these kind of foods. So bringing it back to, it just is going to create so much stress and anxiety for the person. So what's the alternative way? How do you flip this? And how do you think of this in a different way when working with your clients?
Yeah. So what we want to do is address, so the foods, from my point of view, the food is not the problem. The sensitivity is the problem. So why is the body so sensitive? So that's going to be for a whole variety of reasons, right? But why is that body so sensitive, digestive function, immune function, and so on, that you can have these normal, otherwise healthy foods and be so reactive? So that's what we want to be addressing. So that then you can have all these foods again, it generally, start to add all these things back in and not have the flares happening. Certainly not having them happen so easily and so readily either.
So severe and so often.
Yes.
You'd say. Yeah. And so what are some of the factors that can throw things out of balance and contribute to this tendency towards overreactivity?
Yeah. So when we're talking about children, so this is a could almost be a podcast topic on its own. But when we're looking at kids and we just list a few of those bigger contributing factors, one, C-section. So very regularly, a lot of my clients will, these children will have been born via C-section. So that's a very common situation in my clinic.
Is that
because that's going to alter that early gut colonization so that the microbiome will be developing differently.
And it's when we pass through the birthing process, isn't it? That's when we get past our mothers.
Yeah. So, and there's a few things involved in that whole picture, right? So yes, there's that.
Yeah.
Then often you'll have longer time in that hospital environment. So the microbiome in the is different in that environment. So it's a more sterile environment, right? Then you will have often so antibiotics will go alongside that C-section birth as prophylaxis even. So there's that. So there's a whole bunch of reasons why that has such an impact, but it definitely has an impact. And then recurrent antibiotic use, either in the mother during pregnancy, at birth, with the baby after birth, all of those things will have an impact. Our, obsession with antibacterial products in general. So that is affecting our environmental microbiome. Whether it's cleaning products, hand washes, hand sanitizers, all that stuff that we, come in contact with so often, that's playing a big part. Genetics, as I mentioned before, genetics is going to play a part, but doesn't mean you can't, that there's nothing set about that though, in that, you know, my parents had this and I will have this, but
Yeah.
it's just something to consider for sure.
Mhm.
Nutrient deficiencies, as we talked about before, and there's a whole bunch of reasons why that can be, why that happens. And an imbalance, and this comes into play as well with that early hospital exposure too that I was talking about, but not just the microbiome in the digestive system, but the microbiome on the skin is going to play a big part, because that you will find that generally people with eczema will have a higher amount of staph aureus bacteria on the skin.
Interesting.
And that's an inflammatory type of bacteria that can cause an issue with the skin barrier itself, and a lot more inflammation and so on. And that can be affected by some of these things that we've just talked about as well.
Yeah.
So all of those things and many more are playing a part in how this, develops in the first place.
And one other fun fact we came across recently is the mold on the skin as well. The Malassezia species of mold, they're also finding that there's imbalances with people with eczema, that they're having a higher numbers of this mold, perhaps because there is that imbalance with the good bacteria preventing it. But there's a few different factors at play. It's really interesting. And when you wrote the blog for this, you also mentioned sort of saying that food matters, but it only matters in context. Could you help explain that a bit more? Yeah.
So there's just so much more to it than that, So, I mean, it's, generally speaking, the clients that I see, they feed their children very well. They eat very well. So this is we're not talking about people that have a highly processed diet or anything like that.
Yeah.
Which shows, just in that shows that we're not just food plays a part, but there's so many other factors that need to be considered. It's never a matter of, because people will often say, everyone just says to me, well, just don't eat this, or just don't eat this, or just try and, it just, if it was simple as that, then we wouldn't be having this problem, right? So, we need to look at this in a much broader way, and there's a lot more playing a part than just individual foods and whether they're causing a flare or not, which is kind of what we've gone over anyway.
And just to share a personal anecdote, I related to something you just said so much, because I have autoimmune psoriasis. And when I had a terrible flare-up a couple of years ago, the number of random foods that people told me to cut out, it was ridiculous. One of them being oats. The other one, don't eat meat. The other one was only eat meat, go carnivore. And I thank God I have the context of the work we do here. I was just like, it is not that. Like, I wish it was that easy. I could just stop eating oats. I don't even eat them anyway. Like,
exactly. I mean, we'd be out of a job. If it was this easy, we wouldn't,
it was just, but it just blew my mind. And it's coming from a place of wanting to help. And I get that, but it's so frustrating.
Of course,
with skin conditions, thinking, you think I haven't thought of that? Like,
And going back even to when we were talking about the microbiome and so on, when you're you start to remove all these things, then when we're looking from a microbiome perspective, problems there can become a lot worse because of how your microbiome is feeding off the fibers in your food. So that is how they're thriving. So your healthy bacteria are thriving off all these different fibers that you're getting from your foods. And if you start cutting out all of these things and have because that's the other thing that you'll end up, when people have been doing this for a long time, they can end up with a very plain, limited diet. I mean, she doesn't actually have eczema, but I've just thought of her as the example because I've seen her so many times. But she was eating, I think, 12 foods. For 10 years. And that food sensitivity can then become a lot worse, because if you're looking at how the microbiome plays a part in this immune function and that sensitivity,
Yeah.
If you're essentially starving all those good bacteria
Yeah.
from their fuel source, then just slowly, that problem is going to start getting worse and worse.
Yeah.
And this is exactly, which you will know, it's exactly what we hear
Yeah.
is it used to be whatever, gluten.
Yeah.
Now it seems like it's all of these things. Now I have no idea what I can eat because it just seems to be getting worse and worse.
Yeah. And we also find the way I explain it to clients is that when you start reacting to one thing and you're getting all these inflammatory markers and histamine and all that kind of stuff, it can start to sort of snowball from there. It affects the gut microbiome and other inflammatory factors. And that's when you can start to find you're just reacting to everything. And we've worked with kids who are literally on brown rice and stewed pears, and that's it. So I can just only imagine what that's doing to the gut microbiome as well.
Yep.
And one other point I wanted to bring up as well to hear your thoughts was we see there's a lot of guilt from parents, either if they've had eczema themselves as well, they feel a guilt that is there something they're doing wrong or something that they're missing? And I think you've just hit the nail on the head where we're working with clients who are eating the right things, doing the right things. They bought the air filters. They're doing all the dust mite covers and all that kind of stuff. They're doing all the right things. So it's not something to feel guilty about.
Oh, yeah. And that's exactly how people start to feel, or the parents start to feel, is that what more can I do? I feel like I'm doing everything, but obviously I'm missing something. That's what they're feeling like, is that, well, it's not fixed, so I'm not doing enough.
Yeah.
When they're already doing everything they can possibly do, it's an impossible task to do on your own anyway, there's just no way that they can work this out. There's so many, all these different things, and we're just skimming the surface, really, all these different things that can play a part.
Exactly.
It's impossible to be addressing on your own, and I have, maybe off topic a little bit, but I have no doubt that because the other thing that I hear people say a lot is that, once they start to go to all their different appointments and their dermatologists and all this sort of stuff, people are being told, well, is it just, is that really happening? Is this just something you're that kind of
exciting,
which, is a real problem.
Yes.
But I have no doubt that the stress of this situation, though, is playing a massive part in the further development of the situation.
For sure. Yeah.
Because the impact that emotional, energetic, and biological impact that's having on the digestive function and the immune function and all of that stuff is just slowly going to be, making things a bit worse as well.
For sure. Yeah. And this is where a lot of people, the stage that they're at once they reach us and they're seeking out positive association technique, they've tried everything, they're doing all the right things, and it's just kind of, what am I missing? What is the missing piece here? So how do you find PAT beneficial in these cases?
That is where, that's where it does its best work, in that, even though you have all these underlying factors that have contributed to or adding to and all that sort of stuff, what they need is some answers, for one, and to take away a bit of that guesswork.
Yep.
And just some relief. So that then, if there are other things that need to be addressed to help rebuild the body and all that sort of stuff, that's fine. We can just at least start taking the edge off and allowing some of these foods back in. They can also feel comfortable allowing them back in.
Yeah.
Because even, if I'm to say, listen, don't worry, just start eating these things again, we'll start rebuilding the body. People are very hesitant to do that, obviously, because
it helps with some of the fear, I guess.
Yes.
Yes. Yeah.
Yes, 100%. So it helps with that. Yeah. It helps them feel more comfortable in trying to add things back in as well.
Yeah.
And the way these so often people will have also have already had some other, not always, but often had some skin prick testing and, that sort of thing. And that can be helpful if the allergy is mediated in that way. If it's not, they're being told, no, well, you're fine with that stuff. And they're like, but I'm not. I'm not. I know I'm not, because we're flaring with those things, but the testing parameters are just measuring what the testing is meant to measure, but it doesn't work that way for everybody,
No, and looking for that IgE mediated, which is that classic atopy, the genetic factor when it comes to eczema. And something I'll often hear when speaking to clients on the phone as well is dust mites is one of the main things that comes up in the skin prick testing, because it's often IgE mediated, but then it kind of just becomes, I only have a dust mite allergy. And it's sort of, we need to sort of remind people that it is a combination of a lot of different things, and once again comes down to that general overreactivity. It's not about just pinpointing one allergy or sensitivity or intolerance to explain all of these things. So for people who might be listening to us for the first time, could you give your little spiel or run through of how the PAT testing works and treatment?
Yeah. So, I mean, the great thing about it is because I work with children a lot, is that you can have a baby that,
super gentle,
any age, from baby to elderly, whatever. It's fine for everybody. It's gentle. That's the other thing that's happening, right, with conventional allergy, testing and stuff like that. One, sometimes it's not appropriate for a certain age group. Two, parents don't necessarily feel comfortable doing that, doing that type of testing with young kids anyway. And as we were talking about, there's limitations to the testing anyhow. But because we're essentially we're muscle testing, it's gentle, it's easy, we can do it with everybody. And then as far as the again, same thing with the treatment, very, very non-invasive, gentle and all that sort of thing. So we can do it with anybody. In fact, I mean, some of the kids that I do these treatments on is just the cutest thing on earth, like they're just giggling and like cutest thing on earth.
We call it the machine, is it often?
So I don't know what I'm talking about anymore, but just the ease of how you can use it with so many different people.
Yes.
Is the best.
The general rundown of how a consultation goes. So you do a really detailed case history. So that's where you're looking at how long they've had the symptoms, any of those triggers that they have noticed with foods, otherwise household things, chemicals, all that kind of stuff. The muscle testing, you'll go through a whole range of different foods, including those salicylates, amines, histamine, as well as those classic gluten and dairy kind of ones, to see what it is that may be contributing or how many things may be contributing at this current time. And then the treatment, using that chiropractic tool down the back, you're stimulating those acupressure points. And that's a very gentle way of retraining the body, recalibrating the body to no longer have that big reaction to the salicylates or the dust mites or whatever you're addressing that day. So when it comes to how does this less restrictive approach benefit the other areas of your treatment plan?
It gives also more flexibility, right? So you're not in that urgent sort of state of trying to bring down that inflammation and get foods back in. It's taking the load off the family and the immune system. So that whatever else needs to be done, from my point of view, that's the benefit, is that whatever else needs to be done can be done with less urgency, because there's not so much stress around the acute symptoms, if you know what I mean. So I mean, that's where I find it the most beneficial for this type of condition, is that they can get some relief. We can start to actually use food then as medicine as well to rebuild the body, instead of needing to, keep everything out of the diet.
Approach,
That's where it's
Yeah.
does its thing, you know?
Yeah. Well, if you're listening to us from home and are ready to take that gentler, more strategic approach to managing your child's eczema, then working with one of our PAT practitioners like Belinda is a great place to start. They're all qualified naturopaths as well. So to learn more and see if PAT is right for you, you can visit our website to learn more at naturalallergytreatment.com.au. You can request a free PAT information e-pack there, and you can also call us at our head office on 1300 853 023, and I'll pop the New Zealand number in the notes as well. And if you do need more of that comprehensive approach that Belinda has talked about addressing those other factors, once we've helped to reduce that reactivity, you can get further support with the naturopathic consultations with Belinda. And she works in person from her Brisbane clinic and also does online sessions as well. So I'll pop a link to her website in the episode notes too. Otherwise, thank you so much for joining me today, Belinda. It's been really interesting to have a chat about all this stuff. And do you have any final thoughts just to wrap things up for today?
I guess it's just overall from a eczema treatment perspective, what I see is that people are what's conventionally speaking, what's happening is just suppression of symptoms and elimination of things.
Mm.
And it's just not the only way. It's not the best way at all, but it's also not the only way to do this, you know. And it doesn't often get results, and that's why people, if it worked, people wouldn't be looking for another answer, you know.
Yeah, true.
They just, you know, they might get some relief and then it's back, and you know, all this and that's because the underlying problem hasn't been addressed.
Yeah. Mm.
So yeah, rather than, you know, people just suppressing symptoms, eliminating things, I mean, what we need to do is nourish the body, build resilience, repair what needs repairing so that the body is less reactive, and we're not needing that you know, very unfamily friendly kind of way of treating eczema.
Yeah. And so if anyone listening has been stuck in that cycle of eliminating foods and watching for flare-ups and you're still not seeing any progress, you are definitely not alone. So relief is achievable and available. So thank you all for listening today. And if you are joining us for the first time, be sure to subscribe to our channel. You can also follow us on Instagram at natural.allergy.treatment. But otherwise, please send through your questions. I'd love to have Belinda back on here another time to have another chat and go deep dive into another topic. So if anyone has any questions about anything that we've talked about today, please either comment on this podcast, or I'll pop our email in the notes as well so you can reach out there. Otherwise, thanks again, Belinda. I look forward to having you again next time.
Thank you.
Bye.
Bye.